a 23-year-old woman comes to our dental clinic. She tells us that for the past few weeks, her mouth opening has decreased significantly and her mouth burns whenever she eats spicy food. This is a classic presentation of oral submucous fibrosis. Oral submucous fibrosis is a chronic, progressive, scarring disease of the oral cavity, and in severe cases, it may involve the pharynx and the upper esophagus. Its etiology is directly linked to betel quid consumption and its associated products like pan masala, gutka, and mawa. It is mainly consumed in India, but it is now available worldwide in countries like Taiwan, China, and even the US. So, as I told you before, the etiology is directly linked to the betel quid. This quid contains betel leaf and it is wrapped around various products. These include the areca nut, slake lime, also known as calcium hydroxide. This is mixed with tobacco, and all of this is put together with sweeteners, flavonoids, and spices. Now, the calcium hydroxide induces the areca nut to produce alkaloids, which creates a feeling of euphoria. There are some risk factors which increase the severity of the disease. These include tobacco, nutritional deficiencies, chili peppers, toxic levels of copper, genetic predisposition, and immunological predisposition. Now, tobacco is a carcinogen, and it basically causes epithelial alterations. There are some nutritional deficiencies, for example, folate, B12, and iron deficiency, which contribute to oral submucous fibrosis. Some people may be hypersensitive to chili peppers, which contributes to fibrosis of the mucosa. The toxic levels of copper increase the levels of lysyl oxidase, which increases the cross-linking of the collagen. Some people may be genetically prone to oral submucous fibrosis, and in a research, these people have an increased amount of HLA, human leukocyte antigen. And sometimes autoantibody reaction may increase the immunological cells, and the expression of CD4 cell increases on the lymphocytes. Now, iron converts hydroxyproline to 4-hydroxyproline, and this is important for normal collagen synthesis. But in the deficiency of iron, this reaction is going to be affected, whereas there's going to be abnormal collagen synthesis. Also, if there is iron deficiency, there's going to be defected epithelium maturation, which is going to eventually lead to mucosal atrophy. In cases of genetic predisposition, there is going to be increased levels of the HLA phenotypes A10, B7, and D3. This is found in some patients, and they are more prone to oral submucous fibrosis development. And in some cases, there is an increased expression of CD4 on the lymphocytes, so this causes an inflammatory response, which eventually causes tissue injury. Now, to understand the disease process of oral submucous fibrosis, we need to know that basically the collagen metabolism is disrupted. Now, to understand this, let's look at the epithelium first. These are the epithelial cells. Just under it is the basement membrane. Then we have the macrophages and mast cells. Then these are the fibroblasts, and these are going to produce collagen fibers. So first of all, the areca nut is going to release alkaloids. These alkaloids are going to act on the epithelial cells, and this is eventually going to stimulate the fibroblasts to produce collagen fibers. Next, the flavonoids are going to inhibit the collagenases. The main function of the collagenases is to catalyze the collagen fibers. But if this is inhibited, there's not going to be any collagen breakdown. The copper increases the levels of lysyl oxidase. Lysyl oxidase is an enzyme which is involved in the cross-linking of the collagen. So, if there is an increase in the lysyl oxidase, then there is going to be increased cross-linking, and more fibrosis of the mucosa is going to occur. Then we have some activated inflammatory cells, for example mast cells, macrophages, and lymphocytes. These activated inflammatory cells are going to produce cytokines and growth factors. These cytokines and growth factors in turn induce the fibroblasts to produce even more collagen. Thus, all of this process is going to contribute to an increased collagen deposition, and which is going to lead to the fibrosis of the mucosa. Moving on to the clinical features, trismus occurs because there is a deposition of the collagen fibers in the oral mucosa, and these bands are created. This limits the mouth opening. In moderate cases, intra-incisor distance may be of less than 20 mm, whereas in advanced the jaws may be inseparable. There is going to be generalized burning of the mouth, also known as stomatopyrosis. Some people have also reported of having an increased dry mouth. The mucosa becomes blotchy, marble-like, and even pale, and it becomes progressively stiff. In some cases, some people have reported that there may be immobility of the tongue, and the tongue may become devoid of the papilla, and eventually it diminishes in size. In fully developed cases, the fibrous bands are palpable. Some of the most common locations are the buccal mucosa. This is where the betel quid is placed. The soft palate and the labial mucosa. Betel chewers mucosa. Betel quid chewers exhibit a brown-red discoloration of the mucosa with irregular surface which tends to peel or desquamate. Sometimes, leukoplakia is also associated with oral submucous fibrosis. Other things like tooth staining, atresia, and periodontal diseases have also been reported in oral submucous fibrosis. The betel quid lichenoid reaction. Now, in some cases, we observe that there are white parallel wavy strias which resemble the lichen planus. Now, it is important that we differentiate this lichenoid reaction from the lichen planus. In the lichenoid reaction, due to the betel quid, there is not going to be any overlapping or crisscrossing of the wavy strias. But in lichen planus, as we can see, there may be overlapping. The wavy strias are not elevated in case of the betel quid lichenoid reaction, but in lichen planus, they are elevated. And the main etiology is the betel quid, so we are going to see these wavy strias present in the site of the betel quid placement. And in lichen planus, mostly women above 50 years are affected. Now let's discuss the histopathology. First of all, we're going to look at the epithelial changes that occur in the histopathology. We're going to see some subepithelial vesicles, and there is going to be an increased thickness of the keratin layer in early lesion, as we can see in this picture. The cause of this is that this is an adaptive response to the local irritants to provide protection to the underlying connective tissue. In older lesion, we may observe epithelial atrophy, and some of the reasons have been hypothesized, but we are still not sure what the exact cause of this is. So it may be due to heavy fibrosis of the connective tissue, malnutrition, or it may be just because the epithelium has been stretched too much. And sometimes it may be due to thinning out due to the changes in the connective tissue. Next, we're going to look at the connective tissue changes. These include the juxtaepithelial or just next to the epithelial and submucosal deposition of the collagen fibers. We are also going to witness some inflammatory cells involved. There's going to be hypovascularization of the connective tissue because there's an increased collagen fiber deposition. In around 10 to 15% of the cases, dysplasia is seen, but only 6% of them turn out to be malignant. Now, moving on to the treatment. In mild cases, we are going to administer intralesional corticosteroids, for example, betamethasone. This is injected in the site of the fibrous bands for around 6 months, and this helps to reduce the symptoms and limit the degree's progression of the disease. In moderate to severe cases, surgical excision or splitting may be required. Lifelong physiotherapy has to be done, but relapse is common. Other treatment options include intralesional injection of interferon gamma, topical or intralesional proteolytics, for example collagenases, vitamins and minerals, antioxidants, for example lycopene, but all of these treatment options do not have an evidence of being much of use. Thank you for listening.